Harihi Om. Guru Brahma Guru Vaishnava Guru Deva Maheshwaraha Guru Sakshat Param Brahma Tasmai Shri Gurave Namaha. Good morning, one and all. So, in the previous class, we discussed about the medicine called Noxomeca. So, we'll just brief it up in the first slide about whatever we discussed about the mental symptoms of Noxomeca. So, to start with, we know that the Noxomeca is a very irritable, a very dominant, a very ambitious, and a very workaholic person. We also discussed about his main focus being in life as success. What are the consequences of being a very successful person at the mental plane and also at the physical plane? Today what we are going to do is we are going to discuss where all we can administer the medicine Noxomeca when a patient comes with the physical symptoms. So we will talk about the action of Noxomeca from head to toe. So in the first slide, it is just a a brief glance about the entire thing that we discussed in the first class. It says that Noxomeca is very quick person. So there are so many medicines like Bryonia, Argentum nitricum, arsenic album, Noxomeca, sulfur, Calcarea carpa. So each one's personality varies. Now, if there are all the people sitting here and a pen falls down, some will be very quick, some will be very late, some will be in the moderate phase. So in that sense, the Noxomeca is very quick. Given any opportunity in the work field, given any opportunity to make good money, given any opportunity to get a better rank, the Noxomeca person is a very quick person to utilize that particular opportunity. Then they are very active, nervous and irritable people. They are very active people. When you take Bryonia, no, after few days we will be discussing about Bryonia. Bryonia is a very sluggish person. Similarly, if you talk about Calcarea carp, they are very sluggish person. Sulfur, they are intellectually very active but physically very sluggish people. Arsenic album, they are active but they are very restlessly active, meaning they are active out of a fear. Argentum nitricum is very active, very fast. He also does that in so much of haste and hurry only because of anxiety. Now here we had understood that the Noxomeca is having a great deal of mental work. So he uses his mind more than he uses his body. Then because he is, sitting and working for a very long time, and because he is a very workaholic person, it is very obvious that he is very sedentary. And because of this sedentary life, he has many other things coming up as a consequence. So it says that this indoor life and mental strain seeks stimulants. So stimulants like coffee, alcohol, other habits, such kind of things, he actually seeks for it. So he hopes to, quite this excitement, and he starts indulging into it. So we also give Naxomica to those people who are in that hangover, who have not got out of that hangover. So whenever a person comes and says, I had been for a party and I have taken drinks, but I am still not able to come back to my right senses and right state of mind. Many times Naxomica works for such kind of people. This is with respect to activity. This can also be because of overworking. All night I have worked, now I am having a headache or dizziness or any other symptom because they have worked overnight. You can give Naxomica so that they get back to the normalcy very soon. Next. So he produces irritable nervous system and is very hypersensitive and over impressionable. We also discussed this in the last class, saying he is sensitive to sound, he is sensitive to light, he is sensitive to touch. So this sensitivities can be seen at the all plane, mental, physical and also the emotional plane. And he is very sensitive to odors also. So when an Naxomica enters the house, he can immediately say, okay, you have burned something on the stove, though it's been so many hours that it has happened in the kitchen. But he is very, very hypersensitive with odors. There is also a medicine called Ignitia. The Ignitia is also very sensitive with odors. For example, someone, using a very strong deodorant or a perfume or a body spray, if the Ignitia person is standing next to them, they will immediately start having headaches. He does not want to be touched. Usually, Naxomica people are very reserved with respect to the physical contact in their professional, in their personal life also. Simply, even in our friends group, suddenly we hit someone, we call someone by touching. They just get irritated when we do such kind of things. So they don't want to be touched. Time passes too slowly. Because he is a workaholic person, any time that is available, he will try to put that into work. So whenever there is no work, he does not know what to do. He keeps on looking at the clock and keeps thinking, okay, still it is only so much of time. So time passes too slowly. This happens with one another medicine called Argentum nitricum. So in Argentum nitricum also, the patient feels that the time passes too slowly. Even the least ailment affects her greatly. So any small trigger, the impact of that trigger is very high to this person. Disposed to reproach others, sullen and fault finding. This also we discussed in the last class. Because they are perfectionist, they always want to make sure to show the other person, belittle. Their intention might not be very, negative or malicious, but because they are perfectionist, for them when someone else does not do something, it looks like, oh, what, this person does not know this much minimum things also. So they always keep on finding fault in others. So now we will discuss each system. So there is something called as sphere of action. Whenever you refer to books like Materia Medica and other homeopathic books, they call it as sphere of action. So given any medicine, what is the action of the medicine predominantly in which systems? So there are many medicines like antimcrodum, antimtart, carbo-veg. All this does not have a personality or a constitution. They are all acute remedies. So we understand such kind of remedies only specific to certain systems. Now you might know that Antum crude is used for mainly the digestive system and the skin. It is not used for any other system. So the sphere of action for Antum crude becomes the digestive system and also the skin part. Similarly, Naxomica has a sphere of action. Naxomica being a polycrest or a constitutional medicine. So if you say a polycrest or a constitutional medicine, it is to say that it has a personality of its own. So it has a predominant mental symptom, predominant mind, and the way in which the person behaves. So this kind of polycrest or constitutional medicine will have the sphere of action starting from head till toe. So, but predominantly what is Nux covering? It is covering the central nervous system. It is covering respiratory system, digestive system, back and extremities, excretory system, see, there will be n number of signs and symptoms that you come across in every given medicines, and more the medicines that you go on learning, more is the confusion. So now we know because this person is working too much on his mental plane, definitely he will have something like headache, dizziness, vertigo. So if we go back to our case taking class, we have understood that any symptom that the patient says, we have a format or a pattern to understand that symptom. What is the causation of the symptom? What is the expression of the symptom? What are the modalities associated with the symptom? And what is the location of the symptom? So now taking headache or head, here we have the location of the headache is in the occiput. What is occiput? This one, this part. So whenever, if you see in BP patients, suddenly if there is a rise in BP, they usually start getting headache at the back of the head, which will be radiating to the neck. Usually this happens when there is a sleep disturbance for them. So Naxomica is one specific medicine which is used to reduce the blood pressure instantaneously. High, it is only high. Low blood pressure, we can use medicines like Natrium, which is made out of salt itself, so that will raise BP. Yes. So now how is the headache? Headache is over the highs. Headache is also at the occiput region, and it is also with vertigo. Now if we go back and see why this person can be getting headache, there are several reasons. One is too much of caffeine, so no sleep. When you take too much of caffeine, you will not get sleep. Second thing is digestive disorders can cause headache. When our stomach is very upset, when we have eaten all spicy, non-veg and all that things, it can cause headache. Then losing sleep for a longer time, for 7 days, 10 days, there is exam, the kid is studying, that can also cause headache. Then because you keep working, there is a strain to your eyes, which can also cause headache. Now, the same reasons can cause dizziness, vertigo. So, whenever we are understanding medicine, if we understand the cause, these symptoms becomes easy, because symptoms will be so much. See, only for headache, you have some 9 points coming in the thing. So, if you understand that, okay, Naxomica needs to be given when a person is overstrained, mentally overstrained, he has lost sleep, there is no sufficient rest, too much of food, or too much of caffeine, alcohol, smoking, any of this too much, we can think of Naxomica. Then the second point is oversensitiveness of headache. So, when the headache comes, the person will be unable to look at light, listen to any sounds. If someone comes and approach them, they get irritated. So, that also is accompanied with headache. Then coming to vertigo, what is vertigo? What is the difference between dizziness and vertigo? Yes. So in vertigo, we have the total spinning of the environment. Dizziness is just lightheadedness. It comes, it goes, it comes, it goes. So here, vertigo is with momentary loss of consciousness. So when they have vertigo, no, they lose their consciousness for a small duration of time, and then again they come back. The fourth point is intoxicated feeling, worse morning. What is this intoxicated feeling? Someone have gone out for a party, let's take New Year party. So what do? They go for the night drive, they have drinks, they eat something. In the morning when you wake up, what happens? You don't have that fresh feeling. You get up with an intoxicated feeling. So here the word says intoxicated, it doesn't mean only alcohol or something like that. So I have watched movie the entire night. Morning I have my swollen eyes, not refreshed. That is also an intoxicated feeling. Or I have read the entire night. Morning 6 o'clock I am going to sleep. That can also be an intoxicated feeling. Or you have been working like that, and every day morning you get up with an hangover. All that can be taken as an intoxicated feeling. And it is worst in the morning, and worst because of mental exertion, worse because of tobacco, alcohol, coffee, and it gets worse even in open air. So, there are many medicines, when they are sitting inside a room, they are at lot of discomfort. The moment they open the door and go out in that open breeze, they feel very better. So, there is a medicine called Pulsatilla. They are very better in the open air. But Naxomica is not at all better in open air. They just want to shut all the door, windows, put curtains, and then sit in the room. What kind of the pain that comes when they have a headache is, it is a kind of pressing pain. So there are so many different kinds of pain. It's something called as lacinating pain. So you feel that when a nail is put inside, it is called lacinating pain, as if someone is hitting a nail to us. Then there is a pressing pain, meaning someone is pressing, that kind of pain that comes. There is a squeezing kind of pain. There is a very sharp pain. So the type of pain that comes in headache is pressing kind of pain on the vertex, as if nail is driven in. So vertigo in the morning and after dinner. So vertigo is coming in the morning. In general, Naxomica person is worst after eating. Till the time his stomach is empty, Naxomica person is very good, very active, nothing happens to them. The moment he eats something, because his stomach is so sensitive, all the problems will start after eating. Then frontal headaches with desire to press the head against something. Many people, when they have a headache, they keep doing like this, or they tie something to their head. All that we have to observe. So here, when the headache comes to the frontal part, he likes it to press. Conjunctive headaches associated with hemorrhoids. So these symptoms you all just have to go through. It is very difficult for each of you to remember this kind of. So what is more important? If we remember the cause, any symptom can be cured. We should know what is there in the medicine. But more importantly, is the conjunctive headache coming because of overstrain? Then Naxomica should come to your mind. See, Argentum nitricum can also come. There is a medicine called Argentum nitricum, which we give when the person has been, too much studying, too much of mental work. But what is the difference between Naxomica and Argentum is, in Naxomica it is more focus. In Argentum nitricum it is more tension. The headache comes because of tension, not because of the labor. But in Naxomica, it comes because of the labor. Now, the person is continuously sitting and doing work. What is the but obvious problem to come? Piles. We know that the person is eating all kinds of spicy stuff, very heavy food, and not walking around. Thirst is also on the moderate side. So, definitely hemorrhoids are going to come. We will discuss that in the excretory system. So, this is with respect to the head part or the nervous system part. Then coming to the respiratory part. So, first starting with nose. See, it is very rare that people give Naxomica for a respiratory problem. But what we have to understand in Naxomica is, many times the cough, the cold, the breathing problem like asthma, they all will be because our stomach is not all right. Now, when the stomach is not all right, what happens? There is a lot of secretion of acid. So, there will be a acid reflux. So, because of this acid reflux, what happens? The bile in our body is generated more. Because of this bile, a lot of mucus gets collected in our body. So, when we know that for a very long time, person's stomach has not been all right, it is not in order, and he is again and again coming up with a stuffed nose in the night, or whenever he goes out in the breeze, he starts getting a running nose. All that we will have to think of Naxomica only when the cause is there. Otherwise, we never think of Naxomica for the respiratory problem, because more of arsenic album comes, Hepar sulf comes, Enium cepa comes, many other medicines like Bryonia comes, but we never think of Naxomica for the respiratory point, unless until we know that for a very long time the person's stomach has been in a disorder. So, what does he have in the nose? He has stuffed nose, especially in the night time. Why night time is after dinner. Till he takes his dinner, he might not have a blocked nose. But the moment they take the dinner, the blocked nose will start. Stuffy colds, snuffles after exposure to dry, cold atmosphere, worse than warm. So, whenever he is exposed to dry and cold weather, something like what we have now in December and January, he will have stuffed nose. Odor tends to produce fainting coryza. This is what I said. See, the perfume, someone sells body spray, some agarbatti smell which is very strong, they will faint immediately. Jasmine smell. So when we go into a very close like temples and all the smell comes. Many people who we think it is claustrophobic and they faint, but they faint because of the odors, very strong odors. Many people they don't like. When we travel in a public transport like metro and other things, there are different kinds of people who come in, and some will have a very strong, body sprays. And the moment you stand next to them, you are down with headaches. So that is one very important symptom in Naxomica. And how is the discharge when they get cold? Usually it is a blocked nose. When they talk, it is blocked. And if at all any discharge is coming, it is acrid. What is this acrid? Acrid means when the discharge comes, you will have irritation or burning sensation. Next, the throat. The throat feels very rough and scraped feeling. So this also is happening because of acid reflux. Whenever we feel that, whatever we are eating, it is still there in the throat itself, or when we keep getting burps and all that, they have throat problem. So that throat problem comes because of the stomach problem. Then pharynx constricted. There was a case where pharynx is what? It is our food pipe. There are two pipes, windpipe, foot pipe. Foot pipe will have a normal diameter and a size. There was a patient who came with a shrunken foot pipe, meaning you cannot give him any solids at all, like eating vada and all is ruled out because it just does not go inside the foot pipe. So that case was actually cured with Naxomica. 1 Naxomica given in multiple times, that case got. So there will be many people who says without drinking water I cannot swallow food. I cannot take big pieces of food like vada and all, they make it multiple small pieces and then only they take. Fruits also they cut into small pieces and take. So that is because the food pipe would have got constricted. It can be because of muscle muscle loss or the nerves not functioning there or size shrunken. Bleeding in the morning, nose bleeding. Nose, only in the morning it happens. Many people will come like that. Ma'am, I feel tired only at 11 o'clock in the morning. There is a specific medicine called sulfur. So all these kinds of things is what will help us such a particular medicine. Now bleeding in the morning is also there in bryonia. Whenever we see there is a nasal bleeding, we think that it is because of excessive heat in the body. So what they usually do, they put some water and they make the kid lie down in a slant position so that the bleeding stops. Here the nasal bleeding happens in the morning only. It also happens in bryonia, it also happens in natremure. Then there is one more medicine called glonine. All these four medicines have nasal bleeding. Next. So next, coming to the most important system of Naxomica is digestive system. This is very important. Half the cases you will understand it is Naxomica when you know the stomach is a problem. Now what problem do they get? They have a very sore taste and nausea in the morning after eating. Many times whatever we have eaten yesterday, day before, suddenly when you have a burp, the taste of that food comes up. Like that they have in their tongue, they will feel that it is very sour or bitter and they have nausea in the morning. Then weight and pain in the stomach whilst eating and after some time. The problem with Naxomica people is their stomach always feels heavy. That is why after eating anything, they feel even worse. And when we are talking about respiratory system, when they have this asthma, no, so their asthma becomes even more because this is already heavy. So this is putting pressure on the lungs, which is not making them breathe properly. So this heaviness of the stomach is to be asked. See, whenever any person comes for digestive problem, ask them, do you have bloating of stomach? See, bloating is very evident, you can see. Even if the patient does not tell, we can see the stomach would be more distended than what they have the distinction. That is one thing. Second thing, we have to ask, are you getting burps or not getting burps? And when they are getting burps, are they getting revealed after burping or not? The third thing you have to ask is there any gas passing downwards? If they say yes, then does it smell bad or not? Then the third thing is, do you have nausea or no nausea or any vomiting sensation? Then about the pain. Then even in pain, there some medicines will have only upper part, some will have only lower part, some will have entire part, and some will have burning sensation. In Naxomica, there is no burning, there is no burps, nothing like that. There is no bloating also. But without anything, his stomach feels that some stone is sitting in the stomach. That is a feeling that Naxomica person will have. And he has very sour and bitter burps coming up, but this is not very common. If the burps are too much, you can think of Karpovich, not Naxomica. He has nausea and vomiting with much, uh, what is that? That is belching. I have written wrong. Okay, and he has extreme hunger, but if he eats, he will not be better. Okay, and then the region of the stomach is very sensitive to pressure. When we touch the baby to, test the abdomen, we usually press and check whether the abdomen is hard or soft. The moment we go to touch it, the baby starts crying. That indicates that there is a lot of sensitivity in the abdomen region. The epigastrium is bloated with pressure of a stone. So this feels like a stone. Epigastrium is here. This part of the digestive system is called epigastrium. So these feels very sore. So the best thing to understand Nakshamaka is whenever we have gone to some marriage or some party and the food was not nice, the next day whatever you start feeling with respect to your stomach, no, that is all a symptom of Nakshamaka. He loves fat and he tolerates them well. So food rich in fat, like oily, rich gravies which have lot of cashews in it, which are blended, non-veg food. In non-veg also there are so many varieties where the fat content is too much. He just loves them, but he can also tolerate them. There is one more medicine which is called pulsatilla. Pulsatilla likes it, but the pulsatilla cannot take it. The moment they take it, they have a problem. Difficult belching of gas. Okay. Wants to vomit but cannot. That is nausea. So the patient feels like the vomiting is coming, but they will not be able to vomit. Now coming to the abdomen part. So this is used for ulcers. See, we see many people whenever they start eating, immediately after eating, they might have vomiting or they might have a lot of burning sensation because there will be peptic ulcers. Naxomica is one very good medicine for peptic ulcers. Then proves soreness of the abdomen walls. So you feel that only the abdomen walls are paining. Nothing is happening inside, but only the muscles of the abdomen are paining. That is there in Naxomica. Colic from uncovering. See, these kinds of symptom is what is very weird in homeopathy. So uncovering is what? A part which is exposed. For example, when a lady wears a sari, this part is not covered. So that part which is not covered only will have pain. So now I am wearing a chudidar. So my extremities are open to the air. So what is not covered with the cloth, only that will have pain. So when we talk about colic, it talks specifically about the abdomen muscles pain. So whenever we say colic, it means stomach pain. So if the stomach, I am wearing a chudidar, so everything is covered. So now I don't have colic. Now, for example, I wear a crop top or some other thing where a little part of the stomach is seen, only that part will have a colic. So that is what he is saying. Liver is enlarged with stitches and soreness. See, we go back and understand the habits of Naxomica. He is into alcohol, he is into other things like tobacco, a lot of caffeine. So what do we see usually in the reports? Starts with fatty liver, can become ascites, can become cirrhosis of liver. All this, the stomach related problem, liver related problems are seen in Naxomica. Then hernia. This is one medicine that is used for hernia. Now, what is hernia? See, all our parts are put in a good, well covered pouch kind of a thing. Now, this what happens either because the person is having too much of cough, keeps on coughing, there is a pressure built, or for some reason that particular part comes out of that pouch which is giving the support. This particular thing is called hernia. So what do they do in the modern system of medicine is they just send it back to the same position and put a mesh kind of thing so that it should not fall back from its position. That is called hernia. So hernia can happen in different position, umbilical hernia. There are so many kinds of hernia. But in hernia, when the hernia is strangulated, meaning it has got some twists and turns with itself or with some other organ, Naxomica can be thought of. Then down it is talking about umbilical hernia of infants. That also can be treated without going for surgery. Next. This is also very important. Naxomica is known for its constipation. So, if we go back few years ago, there was no concept of reading in bathrooms. So, we have got this concept of reading newspapers in washrooms and all from our Western countries. Now, if you go back and look at the habits of Western countries, what do they eat? More of breads, and to digest bread, it takes much more time than what we are eating here in India. So usually they take help of the drinks like Coke, Pepsi, Sprite and other things because to compensate this. And we see major people having constipation as a problem. Now this, because of this constipation, they sit for a longer time in the toilet. Because they are sitting for a longer time, they want to do something in that. So this newspaper reading, mobile, all this habits have come because of this. And the one specific thing in Naxomica is the constipation is relieved when the focus of mind changes. Now the baby is sitting and trying to pass motion, but he is unable to pass motion. Suddenly, the mother diverts the topic, the baby's attention to some toy or something. Immediately, the motion is passed. Understood. That is why this, Western countries have the habit of reading something because their focus is on not passing the emotion. When they are reading something in the newspaper and their focus is on something of the content of the newspaper, then automatically the constipation gets relieved. So Master EK, when he'll be treating a pregnant woman, she'll be in her labor. She'll have a lot of pain, but how much ever they are trying, it the baby just she cannot deliver. Suddenly, what happens in the road? A drum sounds will come. There will be some procession going. When that drum sounds comes, the lady's focus will get shifted to that drum sound. No, the delivery will happen. So basically, that particular focus has to get shifted to another focus. Then only the body is able to excrete. See, in a normal delivery, the baby is like coming out of your body. No, it's not like a C-section where we take it out. It has to come out. So it is also, like how you pass motion, the lady also had to put out that baby. So once the focus got shifted, then the delivery happened. That is one of the very important symptoms of Naxomica. Then these people have one more variety. First stool will be constipated, alternating with a diarrhea. And we also see that every time a person eats food, immediately they go to motions. Now we see this in people with IBS. We see this in people who have been taking metformin for a very long time. We see this in where the acid levels in the body are very high. The moment you put food, it goes out. So for all such things, Naxomica can be used. And they always feel like going to motion, but when they go, they cannot pass motion. We see, many people when their stomach are not fine, they keep running to washroom and again they come back. And then when the mother asks, what happened? Why are you going like this? Is, no, I'm feeling like getting, but I'm not getting. So that feeling is there in Naxomica. That is what he says. Frequent small evacuation, or sometimes only very little motion comes. Again, they have a feeling that, oh, again I want to go. That complete bowel movement does not happen in Naxomica. Next. Okay. This is about the digestive system and excretory system, which is very important. Now we are coming to the female reproductive system, meaning periods. So, in every medicine, we have a characteristic of how it happens, when does it happen, and how much happens. So, here what happens, the periods are too early. See, the normal cycle of a period is 28 days. So if someone is getting within 10 days, 15 days, 20 days, we call that to be too early. Now, many people with PCOD, many people with fibroid problems will have this particular problem. So, the period is coming too early and it is lasting too long, meaning in a month, the girl is getting twice and the bleeding is happening for 10 days. So, that is a characteristic of the periods in Nux vomica. Menses too early and last too long. They are always irregular, always. And the color of the blood is black in color. That means to say what, when we are taking case taking, all these details we need, otherwise we cannot select Nux vomica. So when we talked about the female reproductive system history, we are supposed to ask, okay, what is the color of your blood, how many pads do you use in a single day, how many days do you bleed, and again for how many days do you get a cycle. All this information we need to ask in case taking. Then only we will be able to put that same match the following here. Even for prolapse of uterus, Nux vomica is. No, how we can relate this prolapse of uterus is a lady who is always angry, a lady who is always, very ambitious, always into work, not taking care of herself. In such a lady's mindset, when they have a prolapse of uterus, you can think of Nux vomica. But just because you are seeing in the scan report there is a prolapse of uterus, we cannot write Nux vomica. If that lady's mind matches with Nux vomica's mind, then we give Nux vomica. Otherwise, no, because prolapse of uterus can be cured with pulsatilla, thuja, sepia, silesia, many other things. What has to match is that mind of the person has to match with the pathology of the person. Dysmenorrhea. What is dysmenorrhea? The pain that a lady gets during her cycle is called as dysmenorrhea. So when you open Materia Medica and see, all these terms will be used. So intentionally I have also used the same terms. It is the pain that comes during that 3 days of the periods, which we call it as dysmenorrhea. So in this also the pain comes in the sacral down, and they have constant urging to pass stools. So not everyone has the same kind of pain. Though all ladies have the cycles coming in, some will have only headache during the cycle, some will have only vomiting sensation during cycle, some will have lower back pain, some will have only leg pains, some will have very sore kind of feeling in their breast or heaviness in the breast. Some will have spasms. Suddenly the stomach is getting into spasm and it again relaxes. Then there is a pain here, or some will have pain down here. So in Nux vomica, what is happening? They have pain in the sacrum, which is also associated with constant urging to pass stools. Then in labor pain, I already explained that example, no? That is what inefficient labor pains. Then metorrhagia. What is metorrhagia? It is excessive bleeding that happens in the cycle is called as metorrhagia. Okay, next. Now coming to the respiratory part. In respiratory, what we have is hoarseness of the throat. When they talk, it feels very hoarse, and there is a sensation of someone is scraping the throat. We will be doing like this, or we'll be making some sounds, no? Like this, because we feel that there is an itching sensation in the throat, so we keep doing that. That is there in this. Asthma with fullness in stomach, morning and after eating. Whenever you see a person with wheezing, and if the person is saying that their stomach is feeling very heavy and they don't want to eat anything, then only you can think of Nux vomica. Otherwise, the bronchial asthma has so many other better medicines to be administered. Cough with sensation of as if something were loose in the chest. Many patients say, no, doctor, there is something here which is not coming out. But I feel that there is something here. That is a sensation that the person feels in Nakshamika. Shallow breathing. If we have seen, observed dogs sitting and breathing, how do they breathe? The breathe does not come from the abdomen. It is a very shallow breathing which comes from here. So Nakshamika people also, they do not have a deep respiration. This is all when they are having asthma. It is not in the normal time. When they are having the asthma, their breath is very shallow. They will be only breathing like this. Then oppressed breathing. So whenever our stomach is very full, what happens? Our chest feels very heavy and kind of full. Many times we feel like, okay, let me drink a soda, let me take some Eno. Then suddenly what happens? The chest region feels okay. Now why the chest region is feeling okay? Because here the gas is gone. So there is no upward pressure for this. When there is an upward pressure, that breathing happens like that. Tight, dry, hacking cough at times with bloody expectoration. So during cough, they might have certain stains of blood coming out, but the cough is very dry. And when you listen to that cough, it will be like, bark of a dog. When a dog barks, there is that sharp sound that comes. That is how their cough will be. Cough brings on bursting headaches and bruised pain in the epigastric region. So when a person is having cough, they also have an headache and also a pain in the epigastric region. Next. So on the other day when Natarajana was giving the explanation for Nakshamika, he was saying this is the only medicine where to turn other side, this side or that side, the patient cannot turn directly. The patient has to get up from the bed, then turn and then sleep. So I am sleeping like this, I want to turn right side. Usually what we do, we usually turn directly on the bed. But here the person cannot. He has to get up, turn like this and again go back. And here it is used for back pain, especially in the lumbar region. Okay. Okay, then coming to sleep, which is very important. In sleep, whenever we are talking about, insomnia, that is sleeplessness, there are many things that we have to ask. When they go to bed, is there a problem to get into sleep? Or they get into sleep immediately but wake up at particular time and again cannot get into sleep? Or they sleep till certain point of time and again wake up and never get into sleep? All these are something that we have to ask. Now in Nakshamika, this speciality is he cannot sleep after 3 a.m. So getting into sleep is not a problem. 9 o'clock you sleep, you get sleep 10 o'clock. But what happens whenever he is sleeping, irrespective of the time, after 3 o'clock he cannot sleep. Many will tell this. Madam, somehow 3 o'clock or 4 o'clock in the morning I wake up and I never get sleep again. That is a very specific symptom of Nakshamika. Drowsy after means immediately after eating is very drowsy. Many people you can see at home. Immediately after they eat, they'll settle down on the sofa and they are so very sleepy. You will be talking and they'll be like half asleep. Dreams full of bustle and hurry. Obviously, his life is only like that. So, whatever is in your life will reflect in your dreams. Better after a short sleep, meaning these people can have just a cat nap. They sleep for just 10 minutes and after 10 minutes they are completely fresh to do something. So, these people have that blessing in disguise. Skin and fever, they are all not important. So modalities, you should remember this modalities. See, these modalities are common for all the symptoms. So worst after eating is there in all the symptoms. Whether you take headache, whether you take, female problem, whether you take stomach problem, all the symptoms are worst after eating in the morning and mental exertion. See, this is common. Words morning, mental exertion after eating, touch, spices, stimulants, narcotics, dry weather, and cold. These are common for all the problems. And what is he better off? He is better after a nap when allowed to finish it in the evening while at rest in damp, wet weather and strong pressure. So, an Noxomica patient is always worst after eating in the morning, mental exertions, touch, spices, stimulants, everything that he likes is basically making him worse. And he's better, once he takes a nap and, during rest in damp, wet weather. So there is something called as relationship. So this Naxomica can be related with other medicines, meaning there is something called as complementary. After you have given one dose of Naxomica, the person is very better. But when we take a case, he will not have Naxomica symptoms, but the symptoms would have changed to something else. So the medicines that follow them well is sulfur and sepia. So for every medicine, there will be a complementary medicine and there will be a inimical medicine, what we should not give after Naxomica. So for Naxomica, nothing is given for now, but complementing medicines are sulfur and sepia. So this is about the Naxomica's physical symptom. Any question has come? All of you, please go through the mentals of Naxomica and also the physical symptoms. Physical symptoms you will get in Boric Materia Medica. The mental symptoms, last time I told about Kent's Materia Medica and Essence of Materia Medica by Vitolcus, and also homeopathic psychology. These three will give you a good understanding about mind. But whatever I discussed about the physical symptoms, it is there in Boric. So you will have to go through Boric. If any doubts, you let me know, but we'll stop here because next week we don't have a class. So I don't want to start a new medicine. We'll just understand Naxomica for now. We will meet the next week. Okay.
But whatever like this past years, like the person is having so many type of complications, but still they are taking Naxomica. So that is always the start of the medicines, or how it will be? Like any person is coming to
No, no. Any person we will not give Naxomica. Someone who is coming to us has already been treated by a lot of doctors, given a lot of medicines. See, for example, psoriasis. Let's take psoriasis. Psoriasis is some disease which cannot be actually reversed. Now, what happens because it looks very bad on the skin? First, they would have tried with dermatologist. They would have used some steroids, ointments, tablets, everything. Then after a few years, they think they will try Ayurveda. Then they go to Ayurveda. And again, they take few medicines, some applications. Then last, because they have tried everything, they will come to homeopathy. Now, what happens? This psoriasis, which is there for last 10 years, the person is also taking medicines for 10 years. No? So, the initial symptoms of the psoriasis is now all changed. When Dharmat gives medicine, something will change. When Ayurveda person gives medicine, something else will. By the time the patient comes to me, there is a lot of medication that is done for which we give Naxomica. It's not the rule that someone who comes with a lot of symptoms or something, it is not like that. Only when the person is over drugged with medicine. Now today, for example, even our parents or everyone, For BP, they have one medicine. For sugar, they have one medicine. For cholesterol, they have one medicine. As supplements, they have another one or two medicines. They have thyroid, they have one more medicine. So almost about five medicines into two times, let's say 10 tablets per day for 10 years. How much of drugging happens on our body? So when the patient has undergone so much of medication, we first give Naxomica so that the consequences of that medicine are nullified. Then we get to know exactly what is their problem and then they give. It is not a rule that we have to give to every person. You know, this person has been admitted in hospital for months together. They have given that, this, that, all that. Nothing has happened. Then later they come to us. Then first thing is we have to clear the consequences of the other medication. Whatever, even if someone has taken homeopathy, say about 10 years daily, 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 that also needs to be antidote. Then only we give Naxomica, not otherwise.
There is a like, what is the main process that will come under the complementary drug? But the complementary medicine will come. After you take the Naxomica,
First you give Naxomica, you send them. They'll come back after a week's time or 15 days time. You again then take a case. Then they will have a personality. That personality can match to Naxomica only or arsenic album or argentum nitricum. Then we give their constitutional medicine. But this giving for clearance and all should be with us. We don't tell this to them because again they start getting a lot of questions and fear that what are these people going to do. No, this is only for our reference. We give them first dose of Naxomica. Many things will get cleared in Naxomica only. For example, a diabetic patient will come to you. She will say, I am having frequent diarrheas. Every time I eat food, I have to go to motions. Now, because she has taken 10 years of allopathic medicine for diabetes, you might have given Naxomica. But Naxomica also has a symptom where immediately after eating they go to, so it would have already closed your case also. If it has not done, when they come back, you have to ask, okay, what got reduced, what got increased, what is still remaining same. Any other doubt? We'll close. स्वस्य प्रजाभ्य परिपालयन्तां न्यायेन मार्गेण महीं महिषा गोब्राह्मणेभ्यः शुभमस्तु नित्यं लोकाः समस्ताः सुखिनो भवन्तु लोकाः समस्ताः सुखिनो भवन्तु लोकाः समस्ताः सुखिनो भवन्तु ॐ शान्ति शान्ति शान्ति